how should people explain pain to their doctor?
Yeah, with the little time that you have in that consult, right?
Yeah.
You want to use your time wisely. And sometimes you come and you have 20 years of story to tell, and you know the doctor only have 10 minutes for you.
Yeah.
So I have a video for that I teach people how to be prepared for this consult. And I tell them, write this in a paper, and I use the Socrates method. So, and there's even a handout. I think if people go to my video, they can check the link to a handout, or I can send to you, and you can put the handout here, Lindsay,
Sure.
in this video. But it talks about, tell them about where is the pain, especially if you can do a pain diagram, like a body diagram. So then paint your areas of pain, and then talk about what is the characteristics, what are the words that you use to describe this pain. Maybe the pain in the head is throbbing, and the pain in the lower back is more constant. So use those words, because that helps us to see, is this more nociceptive, neuropathic, nociplastic? Tell if it's radiating, if the pain is only in that place, or if it radiates to other parts. Tell what makes it better, what makes it worse. What did you try that makes it better? And what made it worse? Maybe sometimes it's light, sometimes it's noise, sometimes it's something that you did that makes it worse or better. And tell about the intensity. We like to ask the intensity from 0 to 10. We don't have a better ruler measure to measure pain. It's the best thing that we have. So think about a number. 0 is no pain at all. 10 is the worst pain. And I like to ask my patients, how is your pain right now? What was the average in the last 7 days, for me to have an idea? What was the worst in the last 7 days? What was the least in the last 7 days? Because I like to know the worst and the least, because I will ask you, what makes your pain go to this high number? What makes your pain, what do you do that makes your pain from, let's say, a 9 to a 3? For me, when you tell me the answer to those questions, it gives me hints about, is this nociceptive? Is this neuropathic? Is this nociplastic? And then it will guide me how I'm going to examine you in the physical examination part. So every time we are gathering that information from history, I am thinking, how am I going to examine this patient? Because when you're telling us these stories, these characteristics of the pain, I'm making in my head a list of potential diagnoses, and then I will go to the physical exam to confirm those diagnoses. And after I do the physical examination, if I still have doubts about what is the diagnosis, I will order some lab tests, blood tests, or imaging tests.